Hello students, welcome to Medical 360. I'm going to cover an institution which is an aspiration for every medical aspirant in the country who wants to study further education in medical field. It's an institution that was conceptualized much before independence in 1946 when a health survey came out in India which essentially talked of how the health infrastructure in the country is extremely poor, because of which India is likely to suffer moving forward. At that point in time, Pandit Jawaharlal Nehru and Rajkumari Amrit Kaur got together to understand and imagine an institution which can be world class, where people, the best people, can study not just going by abroad but studying in India itself. And that is how this particular institution was founded. And by the way, for many of you, I'll tell you how it is funded also as I move along, right? Now, this particular institution does about 90,000 tests per day. 90,000 tests per day is what it conducts and reports within hours. It has about 10,000 plus patients every single day. And one of the highest clinical loads is what it actually captures on itself. It's the national health program and policy decisions, everything. You know, it has experts which are contributing to everything to do with healthcare in the country at this point in time. And students receive elite medical education at an annual fee of less than 2,000 rupees. The fee here is next to nothing actually. Even the 2,000 rupees is not even collected in that sense. So next to nothing is the kind of fee, but you have the best education that you have in the country at this particular institution. And of course, as you all know, and about 22 lakh plus applications come in, only 0.1% or less than that actually manage to get admission here across all the programs, not just one program. Before I move further, 3 requests I always have for you. Please subscribe to Medical 360. We are doing a lot of work to help you get into the best medical career possible. So it's important for us to know that we are helping you out. So please do subscribe to Medical 360. 2, if you want to ask us to cover any of the medical college or any course that you need in the medical profession, please tell us and I'll have a research team work on it and we'll cover that for you. And if you want to talk to us or one of our counselors for any admission related queries, there is a WhatsApp number here. Send us a message and we'll have one of our counselors call you up. Of course, by now you would have guessed, the institution I'm talking about is AIIMS Delhi. Every student who wants to pursue medical education, his or her ultimate dream is to study at AIIMS Delhi. One of the things I'll tell you now as I move along is not just about MBBS and what AIIMS Delhi offers. It is far better that you do another BSc program in AIIMS Delhi than do a MBBS program in some of the institutions you have in the country. Because the quality of learning that you have, the quality of skills that you will develop when you study here, even in the undergrad programs and not just MBBS, are far, far superior to some of the MBBS that is offered by many of the colleges. And from that perspective, what we're going to show you is all the other courses that they offer, besides MBBS of course, but all the other courses that they offer, so that you actually have many more courses as a part of your option set, so that you can study in the best institution in the country. Now, I told you earlier, AIIMS Delhi was founded, imagined in 1946, much before independence, based on a health survey, which actually prescribed that, India doesn't have world-class infrastructure for health, and because of which the country will get into a problem. At that point in time, the first health minister, Rajkumari Amrit Kaur, who became a health minister once India got independence, and Pandit Jawaharlal Nehru got together to start imagining a world-class infrastructure hospital in the country. Now, we didn't have money as a nation. So what happened? New Zealand, through the Colombo plan, funded this particular institution or part funded this institution, and that's how AIIMS was created. New Zealand, such a small country, actually funded India to create AIIMS Delhi essentially. And this, of course, is the first AIIMS that we have in the country. So if you now go back into history, Pandit Nehru imagined IIMS, imagined IITs, imagined AIIMS, imagined NLUs, and so on and so forth. And as a part of that, AIIMS Delhi was created and funded by New Zealand through the Colombo plan. What we'll talk about is the programs that they offer, the entrance exam that you need to take to get in those programs, and the eligibility cutoff and seat matrix for everything. I told you we're moving beyond MBBS. Of course, we'll talk of MBBS, but it's very important for you to understand what are the other programs that they offer, which might be of interest to you. And if you get in here, it is far better than some of the MBBS offered by some of the institutions. Institution, of course, as I told you, is 1956 it was established. It's an INA, which is called Institution of National Importance, right? The campus size is 213 acres. It's a huge campus out there. The NRF ranking in medical is, it's the #1 medical college in the country. No one can take it away from them. Whatever anyone does, you can't take away the #1 medical college in the country from AIIMS Delhi for the next few decades. That's how it is created. And the total students is 1,966 across UG, PG, and 5-year, 3-year and everything, right? and of which 60% are boys and 40% are girls. So that's the kind of numbers that you have as far as AIIMS Delhi is concerned. Now, if you look at the number of doctors and everything that you have, the AIIMS Delhi has about 50 plus departments, 43 departments and 7 centers is what they have, right? They have the total faculty members is 782. The unfortunate part of it is the sanction number is 1,306, but they only have 782, which means they're staffing only 60% of what is needed for AIIMS Delhi. That obviously falls on the hands of the government. And the non-faculty staff, the sanction is 13,464. What they have is 10,910, which means again a 30% shortfall in terms of the non-teaching staff also. The number of undergrad students is 1,243, and the number of postgrad students is 2,233. Right? In all, that way you actually have about 3,500 students also here. Medical graduates is 3,901 they created till date, and postgraduates they created 14,517 till date. And the nursing paramedical graduates that they created is 4,332. Publications and journals is 2,990, and chapters in books where AIIMS Delhi has participated is 369. So that's the AIIMS Delhi at a glance as far as the quality, the quantity and everything that you have out here. Now, what are the hospital services that they have? Now, whenever you're choosing a medical hospital or whenever you're choosing to pursue any of your medical, allied or life sciences studies in any of the medical colleges, one of the things that you must understand is the kind of infra that it has, because much of medical education is not taught in the classrooms, but on the rounds when you go around with the doctor in the hospital, in the beds, how many patients they have, how many emergency care you have, how many centers you have. That's very important. You must always look at the expanse of the medical facilities and medical infra that the college has so that you can learn more. And from that perspective, AIIMS Delhi, of course, excels. They have a main hospital which is including casualty, which with outpatients of 22.68 lakh, which they created, right? RP center 6 lakh 7,000. So you actually have all the centers and how much they've taken care of. Admission is so many. Surgery, they've done so many surgeries. They've done so many general wards. So how many beds? This is very important. By the way, beds is very, very important for you to understand the nature of the hospital. They have 1,920 beds. In the RP center, they have 310 beds. In the BRA ARC center, 189 beds. Cardiothoracic center, 464 beds. Right? NDTC center, 50 beds. And so on and so forth. So actually, in all, have 3,657 beds, of which private wards are 344 and general wards are 3,313. Across the centers, they have this, right? They have one in Jajjar also for that matter, right? So in all, they have about 3,657 beds. Now, when you have so many beds, obviously you need so much nursing staff, so much care specialists and doctors also, which is what we're talking about here. When you have so many beds, emergency and non-emergency, private and general, then you obviously have many outpatients also, and many things follow in place in terms of your training, your skilling, and your learning on the job of what medical profession is all about. What are the admissions that they have? For MSc Biotech and MSc Nursing, they have admission of about 103 students. Every year about 103, 105, right? For MD, MS, MDS, MCH and DM, they're at 480 students. For DM and MCH, 222 students. PhD, 93. Fellowship, 36. MBBS, 132, which is consistent if you notice. BSc Nursing is 31 students. BSc Honours Nursing is 95. And Allied and Healthcare courses is 52. What we're going to focus now is these 4, because these are all for undergrad, right? The MBBS, BSc Nursing, BSc Honours Nursing and Allied and Health Sciences is what we'll focus on. And this is what I'm going to tell you about how you get into it and what kind of courses are offered and what are your prospects if you want to go there. Now, in MBBS, it's a 5.5 year program. We all know that. 4.5 years plus 1 year of internship. BSc Nursing Honours, it's a 4 year program. BSc Nursing Post Basic is 2 years program. BSc Allied and Healthcare Paramedical is 3 years program. And B Optic is 4 years program, right? And this is, of course, entrance exam is NEET AIIMS Paramedical Entrance Examination for Optom. For AIIMS Paramedical Entrance Exam for, again, Allied and Healthcare. AIIMS entrance exam for post-basic nursing, and AIIMS BSc nursing entrance exam for BSc nursing, and NEET UG, of course, for MBBS. All of you know about that. So these are the exams. Essentially, what we talk of nursing examination and paramedical entrance examination. If you actually take these things, you are more or less covered. And for BSc nursing post-basic, you actually have an AIIMS entrance exam only. So they actually have 3 examinations if you look at it beyond NEET UG. Now, you also have the other ones, duration and entrance exams for MD and all. I'll skip this at this point in time because we are now confining ourselves to the undergrad program. So you just take a screenshot if you want to, but I'm going to skip this. We'll come back later when we're dealing with NEET PG at some point in time. But at this point in time, because we're focusing on undergrad, I'm not going through these details. Now, this is PhD program. So what we're trying to show is the kind of depth of learning that is possible at AIIMS. That's the reason why we put up these slides. Not that they're relevant for students who are getting into class 12, but of course it's a pathway for you if you want to go through and achieve the best possible. Now, what are the seats that you have in MBBS? Open category is 48, backward class non-PWD is 33, backward class PWD is 1, EWS is 12, open category is 2, scheduled caste is 18, scheduled caste PWD is 1, scheduled tribe is 9, and scheduled tribe PWD is 1. So in all you have 125 seats, and you also have foreign country quota, which is 7 seats. So in all you get about 132 seats out here. And by the way, every single seat here is taken. Nothing is remaining because it's the most competitive of the lot. Then you get to the closing rank. So NEET UG, you know, about 23-25 lakh students take the examination, but the highest closing rank in the general category for the 48 seats. Across the year, last year it closed at 48. Remember how many seats are there? 48 seats. So right from 1 to 48, every single student has taken the AIIMS Delhi seat straight away. That is a pull of this thing. Not a single student moved out of the 1 to 48 and moved out to choose any other college here. Remember, 48 seats are there in the general category for AIIMS MBBS, and every single 48 students has taken it up. Now that is the strength and the pull of this zone. For OBC, the highest closing rank was 207 last year. For EWS, the highest closing rank was 254, All India category. For ST, 644, and for ST, 1,405. That's the highest closing rank last year, and this is a score, but score varies depending on the year to year. For example, previously it was 715 got 47 rank. Last year, 656 got 48 rank. So obviously, there's 10% deflation in the score while you held on to the rank. That is what it is. So we're not getting at scores at this point in time. We're talking of the rank. You need to be less than 50 rank to have a chance of getting into AIIMS Delhi. Now for nursing, by the way, nursing is only for girls. AIIMS BSc nursing is only for girls. AIIMS paramedical is for boys and girls, but nursing is only for girls. About 2 lakh students register for the examination. The qualified candidate is 19,960 or 20,000, and the number of seats that they have is 1,366. And for AIIMS paramedical, the registered students is 1.5 lakh. About 8,000 students qualify for the exam through the examination, and the seats is 725. So here the competition is 1:12 or 1:11, right? And here the competition is 1:15 or 14. Sorry. So for every 14 qualified students, there is one seat available, and here for every 11 qualified students, there is 1 seat available. So that's quite competitive in that sense. And that too, by the way, after qualification, mind you, the number of students who took the examination is 1.5 lakhs. So here, by the time it came down, it's 5% only qualified, and then so on and so forth. So very, very competitive, even in the nurses and paramedical exams that you have here, because everyone wants to study at AIIMS Nursing. Now, what are the BSc course important dates? The registration starts on 25th March, so it's already started. The last date to apply is 24th April. So we're now not talking of MBBS, we're talking of the other courses, because NEET UG, you already know what's happening, right? So we're going beyond that, because the idea for us is to create an option set for you beyond MBBS, which is why we are doing this. Application status, you would know on 29th April. Correction window is 29th to 3rd May, and 25th, and of course this is done. And the admit card comes on 25th May. Admit card for Honors Nursing is 19th June. Allied and Healthcare admit card is 27th June. Exam date for post-basic nursing is 30th May. Exam date for Honors Nursing is 27th June. And exam date for Allied and Healthcare is 4th July 2026. right? That's the exam dates. Please look at that very closely. It's very important for you to know. Now, dates of entrance exams, I've already explained to you there. So these are just a screenshot of what we discussed. What is the application registration fees? For all the applications fee, the fees between 2,000 to 1,600 rupees. For EWS and all up to, right? But person with benchmark disability, which is PWBD, is nil. But otherwise, 2,000 to 1,600 rupees. That's the fee that you have to pay to, apply for these programs, examinations rather. Now, BSc Honors Nursing for female candidates only, as I told you, right? The eligibility is 55% for general, OBC, NCL, and 50% for the other categories. The entrance test is AIIMS Nursing examination. The total seats is 96. The duration is 4 years. Right, total tuition fees is 2,400. This is the reason why a lot of people want to study here. The fees is next to nothing, right? So 2,500 is the fee that you have. The starting salary is about 36,000 to 50,000 rupees, right? And the career options is nursing officer within AIIMS, ESIC, railways, or private hospitals of CHO, MNS, and MSc nursing. So if you study here, you will find a job invariably somewhere. And the starting salary, if you get into private, is much, much higher also. Because you studied at the best institute in the country and possibly in the world also, it will be in the top very few institutions around the world, right? And the fee is next to nothing. You just need to ensure that you prepare for the examination, write the examination well, and qualify to be getting a seat out here. Now, BSc Nursing post-basic, again, this is only for females, 55% for general category and 50% for normal category. These are entrances, AIIMS Nursing post-basic. There are 50 seats. The duration is 2 years, including 6 months of internship. The tuition fee is 400 rupees. And the starting salary is 75 to 85,000 rupees. And what are the career options? You become a nursing officer or ICU/OT specialist and so on and so forth, or chief health officer. So that is the other course that you have. Now, what are the seats that you have in BSc Nursing and post-basic nursing? In all, for nursing, AIIMS Delhi, 37 for unreserved, 9 for EWS, OBC is 25, SC is 13, SC PWD is 3, ST is 8, and ST PWD is 1, in all 96 seats. For post-basic nursing outside candidates, it's 12 for unreserved, 3 for EWS, 8 for OBC, 4 for SC, SC PWD is 1, ST is 2, and so on and so forth, right? And post-basic nursing basic, AIIMS departmental, unreserved is 7, EWS is 2, OBC is 6, SC is 3, ST is 1, and ST PWD is 1, in all 20 seats. So you have 96, 30 and 50, 20, 146 seats is what you have. And what is the total number of cutoff that you have for AIIMS Nursing? Remember, about 2 lakh students take the examination there. For unreserved, the opening rank is 2 and the closing rank closes at 95, right? So you need to be right up there to get there, right? For EWS, the closing rank ends at 306. OBC, the closing rank ends at 383. SC, the closing rank ends at 2303. ST ends at 4982, right? And your unreserved PWD is at 13,030. OBC PWD is 19,266. That's the highest closing rank for AIIMS Delhi for nursing. And about 2 lakh students, if you remember, I explained to you, about 2 lakh students take the examination. Now, besides that, they also have allied and healthcare options, right? And these are very good courses, mind you. Bachelor of Medical Radiology and Imaging Technology. By the way, you must always look at the allied sciences programs because they're at times far, far better than doing an MBBS in a bad college. Because you can be on your own, you set up your own laboratory, create your own practice, and those kind of things are possible. So, Bachelor of Medical Radiology and Imaging Technology, BSc in Dental Operating Room Assistant, BSc in Dental Hygiene, and BSc in Operation Theatre Technology. There are 4 programs that you have. The duration is 4 years here, 3.5 years. Every year, if you notice, there is an internship, 1 year internship, half year internship, and 1 year internship, right? So, internship at AIIMS is what really helps you, which is what the entire purpose of studying at AIIMS is, because you are working with the best doctors on best cases and actually learning the most. Now, Bachelor of Medical Radiology and Imaging Technology, the eligibility is 12 PCB with 50% for general and 45% for SC/ST. And entrances is AIIMS Paramedical. Total seats is 11 only. 4 years included 1 year of internship. Fees is 1,200 rupees. The starting salary is 35,000 to 45,000. And you can be a radiology technologist, MRI technician, CT technician, cardiovascular technologist, and whatever. That is the career options you have for this thing. But only 11 seats, and about 1.5 lakh students take this exam also, by the way. AIIMS Paramedical. Then for BSc dental operation, its 12th is again the 50% and all, AIIMS Medical. There are only 2 seats, 3.5 years including 6 months of internship. Fee is 900 rupees. And you can become a dental assistant, oral surgery technician, infection control officer. Then you have BSc in dental hygiene. You have 2 seats again here. The same thing, 50% and 45%. The exam is AIIMS Paramedical. The fee is 900 rupees. The starting salary is about 30,000 rupees. You can be a clinical dental hygienist, oral health educator, research assistant. Then you have the 4th one, which is BSc in operation theatre technology. Again, the same 50% or 45%, depending on the category. Exam is AIIMS Paramedical. There are 50 seats here. 4 years included 1 year of internship. Fees 900 rupees. The starting salary is 60,000. Operation theatre technician, anesthesia technician, surgical assistant, and clinical instructor. So you actually have all the 4 BSc programs, very limited number of seats, good competition out there. But if you get into it, then you have a fantastic career option because the fee is next to nothing. The learning is right, sky is the limit for you. If you want to learn, this is the best place for you. And you have a great career option moving forward. Now, what is the seat distribution across each of these things? You actually see it here between unreserved, OBC, SC, ST, EWS. Please take a screenshot of this. You will exactly know how the numbers are panning out. But this is the seat matrix across the categories for these BSc programs. So the reason why we are showing all these things is, it is far better that you study at AIIMS, even if it is a BSc program, than doing an MBBS program in some of the colleges. Because learning the skill sets and the experience that you have of studying at AIIMS is second to none. The fee is nothing, it's next to zero, right? And the opportunities that it opens up, not just MBBS, but beyond that, it can be nursing, basic nursing or normal nursing, nursing honors, or any of the BSc programs, right from operation theatre to dental hygiene to everything that you have. They do have openings out there. It is for you to start looking at those 2 examinations, which is the nursing examination if you're a girl, and the allied paramedical and allied sciences examination if you're a boy or a girl, either which ways, to get into the other programs also. That is the objective why we're talking of it. And of course, we're talking of AIIMS Delhi because it is the pride of India. It is the first medical institution of the country, which is the best possibly in the world in terms of the kind of experience and learning that you will have here. And the fee is second to none, which means that you would have virtually paying nothing while learning the best that is possible out there. I hope this helps you. If you want me to cover any other medical college, please write to me in the message box here. I'll be happy to cover that. Please do subscribe to Medical 360. And if you want to talk to our counselors, just message us on one of the WhatsApp numbers that we're given here, and one of our counselors will call you. Thank you so much. Namaste.